So this is an example of how Yeme undertakes a community needs analysis for a district so that we can take a place-based approach to understanding community needs. In this case, we're focusing on the issue of digital inclusion, and this is based in Birmingham. So the way that we've taken this is to understand how we use the social value to target it to things that are actually driving up demand and services. So the community data platform itself is the tool that we use that embeds all of the data into it and allows us to drop a pin and get a place-based understanding of an area. So the way that we've started this is to look at the different frameworks that are used to assess social value. So the government social value model is based on these 5 missions and these outcomes. We've highlighted in orange the ones that digital inclusion will affect and the works that our programs will involve, the areas of activity. We then also align this with the TOMS framework so that organizations and councils that are using TOMS can still maintain the use of this platform in terms of measuring impact. So that is done in a way that still retains the existing use of those frameworks. When we take an example of the social value standards, this is a list of over 1,300 individual activities. What we can see is that when we look at social value, these are just some of the ones that we've highlighted, will be affected and we'll be able to put a value next to. So things like elderly IT literacy, wellness, loneliness and social isolation. And we know from our work with the NHS Confederation that the indirect outcomes that can come from loneliness and social isolation are also affecting levels of smoking, alcohol, and drug misuse. So when we look at the overall pathways to prevention proposition that the NHS Confederation has designed, we can start to look at what will fall within primary, secondary, and social determinants. And we can see that these will be things like smoking, alcohol, mental illness, education, and worklessness. So we've also developed our own index for digital inclusion, where we took 6 peer-reviewed studies and we identified all the indicators that identify and correlate with people's likeliness to be digitally excluded. And we can see that things like age, education, income, employment are the biggest factors, but we can also map all of these other items. So we've condensed that into this list, which allows us to then actually take a place-based assessment based on the presence of these indicators. We also, in the case of Birmingham, have brought in all of the work that they're doing so that we understand what the baseline is relative to the work that they're already doing so that we can build on that rather than duplicating or undermining it. If we have a look now at the actual mapping, we can use our indicators from the index to see where are these indicators prevalent, and we can almost go down to the street level to be able to understand those places. A key differentiator in our platform is that we have stakeholder information. So we can see within every area of challenge, we can understand who all the stakeholders are within that because they'll form part of our strategy for deploying interventions through those organizations. We also then took the work of the Good Things Foundation and start to understand where are they running different programs and which community partners are they working with so that, again, we can build on that work that's already being done. What we've now done is aligned all of the different indicators and measures so that we've got an understanding of what the relationship is between something that happens at this end, where does it fall within each of the different frameworks. This means that no matter which framework is being used to report against, we were able to create an understanding of our impact in that area. And then this starts to look at where the outcomes are at the end. So when we looked at this and we took the internet provision across Birmingham, we found this is the area where the density of people and the provision of internet supplies was such that that's the most undersupplied area. We then looked at it through the lens of the actual density of the population, the amount of people that are not speaking English, and where there's a high density of people where they don't have qualifications. So that aligns these two places. So we identify these two locations. We then start to have a look at deprivation, and we're also looking at disabled, and we're also looking at the older populations over 65. And this starts to understand where those locations are. We then start to look at the structural inequalities in terms of where they are, and we can see that there's this zone here and this zone here, and that means that we're starting to get an understanding of which issues are located where. So if we take one of the indicators and we start to apply it through all of this, we're actually then able to see that in a location. So what we've done is taken the organizations that are supporting older people and just understanding which are the key ones in our areas of interest so that we've got some understanding of what that provision does. We're also then identifying one of the key target areas where we have a particular demographic, which is within our target interest, and where there are the least amount of supporting facilities. And these are the organizations that are operating within that area, just so that we understand who's operating within there. And when we then select one of these organizations, we can then understand what the performance of that 15-minute walkable neighborhood is around them. And we can see in this case that, for example, we have a very high proportion of young people. We have economically active below the national average, and that's actually getting worse. Youth in good health is very poor, and youth recreation facilities is low. When we look at economically active population, it's low, skill levels is low, and income levels is low. So we start to understand what issues we have within any given area. So when we're looking at, for example, elderly in one-person households, that's very high and it's actually increasing. So we can start to target things based on within that 15-minute area. So if this was an organization that we were going to support, then we know what things to do based on what the circumstances are around them. So this allows us to prioritize key areas, understand the demographics, identify the stakeholders, and then take a community-based approach to resolving and dealing with those things. So that's the process that we use within Yeme Tech, and I hope that was helpful.